Well, hello, welcome. Happy New Year. It's a new year and a new you. So this sign behind me says that's the logo for all the medical people this year, and I'm good with it. Happy New Year, new you. What do you think, Sherri?
I'm all for it.
Yeah, Tim.
I'm in the creation process.
There you go. We're all works in progress, aren't we? Anyway, welcome. This is New Year, New You. It's also Here's to Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner here in town. I have two different positions, one at Family Medical and one at Horizon Medical. And we are going to be focusing on Horizon Medical this evening. We're going to tell you all about it, how it came, what it is, why you should be paying attention and listening up, because if you've got an ache in one of your joints, in a knee, in a shoulder, and an elbow, and a big toe, we can help. So we're going to talk about that tonight. I have Dr. Tim Treanor, who is the owner and founder of Horizon Medical, with me. I'm the nurse practitioner there, so if you come to see Dr. Tim, you will see Dr. Linda. And then on my left, I don't know my right from my left, is Sherri Williams, and she is the case manager at Horizon Medical. So we're going to talk to you tonight about regenerative medicine, what it is, why it came about, who should have it, who pays for it, which is not insurance, I can tell you that, unfortunately. But we're not going to focus on the cost, we're going to focus on the benefit. Sherri has a lot to say about the benefits. She's not only as a case manager, but she also worked in long-term care for a long time. So she's seen what happens when we don't take care of ourselves. And so, you know, anybody who watches this show knows I focus on eating right, moving, taking care of yourself. You've got to be your own advocate. Nobody else is going to, you can't count on your doctor to take care of you. You've got to take care of you. So it's a new year and a new you, and we're going to focus on you tonight. So, Dr. Tim Treanor,
Yes,
welcome.
ma'am. Thank you very much.
So just give the audience a little bit of a idea, or why are you doing this? Why you've been a chiropractor for a long time, you've been in this town for a long time. What made you decide to do this?
Well, what I'm doing this is creating an integration between medical and chiropractic. And it's a true integration. In other words, we're working closely together in the same building. And we're focusing on you. Matter of fact, we had a team meeting this afternoon discussing a couple of the patients that are coming through and some of the issues they have. We look at their x-rays together, we look at their exam results together, we look at all these things together, and then we make our recommendations to our nurse practitioner, who's our medical professional, and then she looks at everything and goes, okay, this is what would be warranted for this situation and that situation. So together, we literally work together to create a plan for the individual coming through, for you, should it be you coming through. And that's the whole point, integrating, literally putting together. She's been in this area for 30-something years. I've been in the area for now coming up on 27 years and practicing. Now that experience is together under one roof to serve you. And that is the really reason why we're doing this. And then why regenerative medicine? Because it seems to be the most powerful way for a person to actually heal and to repair and to renew and to avoid unwarranted surgery and to avoid taking the opioids that are so addicting. You know, it is sad how badly the opioids have worked in our community. And it's just not a cultural thing of, oh, it's just this kind of people or that kind of people. It's everybody. Everybody's involved. And if you just look around you, you probably know somebody in your circle that is unfortunately addicted or on their way to becoming addicted to opioid drugs because of surgeries or other interventions that have not been successful, and their pain continues.
That's right. And it's not only the addiction, it's the consequences thereof, the death that happens to all these young people because they overdose and they take too much.
Well, one of the things, when the medical professionals only allowed to give so many opioids per person. They can only allowed to do so much. Legislation has said, okay, you have to stop after a certain amount. And what happens? Well, they go to the street. They get heroin. They get fentanyl. And it kills people. The statistic that 8 out of 10 people who overdose on opioids are back pain people. Isn't that crazy?
Oh, really?
Yes.
I didn't know that.
Yes. Okay. And then the vast majority of people who are having surgery, the research tells us that most of that surgery is not warranted. There's another route that should be taken prior to surgery. And that's what we're filling in the blank, Linda and Sherri. We're filling in that blank of that's the other option. Let's do regenerative medicine because it repairs, renews, and restores the issue, the things that have been hurt. You hear the term bone on bone. I got told I had bone on bone.
Me too.
Yep. And now I don't have bone on bone. Okay. And we can talk about that more some other time. But now you know my why. I see the destruction that happens without it. And now here we are, integrated as a team, medical, rehab, chiropractic, and we're serving, oh my gosh, the people and how they come in so thrilled of feeling the changes in their lives. I love it.
Me too. Sometimes. Today I've been really busy, so it's good and bad. I like to be busy, but it was really busy. I injected one lady 7 different joints. Shoulders, knees, hips, and her back.
You're a superhero.
I don't know about that, but it, she, and then she asked me all these questions. She said, "Do you think this is going to help my uterine fibroids?" Probably not, Miss Jean, but.
But you know what? She came in without her walker today.
Yep.
No walker. Okay, she has this little 3-wheel scooter that she carries everything on there. Mm-hmm. Came in without it.
She didn't even have her cane today.
No cane,
No
nothing.
cane, no walker. Recommended she has a new vehicle, it has heated seats, and I said, I went out to the car to get something from her, and whenever I got there, she looked over, she leaned over, she says, "I'm using my heated seats." I said, "And they feel good too, don't they?"
Well, not only that, but after the first series of injections she had been housebound for 2 years. Mm-hmm. Part of it, I think, was self-imposed. She had lost a husband and went through some loss and had some problems. But after 2 years and after being in our office and having, I don't think it was just the injections. That's certainly a big part of it. But, just having somebody that talks to her, cares about her, gives her a hug, stuff like that. Sam Bass said that I'm the best hugger in Nash County.
I agree.
I've got Amy, who's our receptionist, and I'm a hugger, and she is not. And she's like this, really stiff the first couple times. And the other day, I came in and she said, "Can I give you a hug?" But anyway, getting back to Miss Jean, she, after coming in to see us, she had been in the house for 2 years, had everybody do everything for her. She got up and went to the Dollar General and went shopping.
Oh, and she went to the grocery store too.
Mm-hmm.
Did her own grocery shopping.
So, I think I'm not going to say all those injections did it and that's why she got up and went. I think it's a combination thereof. But and we had another gentleman today who loves coming to our office because I didn't realize we treated people differently than other offices. I mean, I've never really, paid any attention, but you hear stories of other chiropractic offices that they don't treat people the same way. I'll just say that.
One of the things that we focus on, and all we are is who we are. And we're as real as possibly we can be. We've all had issues, health issues, and issues that have slowed us down that we have addressed, and we understand when a person comes in the issues that they're going through. And it's not that we're going to sit there and relate with you and all that. We want to know and understand so we know how we can help you see. And so having this team in here, and then adding the other ladies on the team, I know, guys, I know you're jealous. I get to hang out with 7 beautiful women. But the idea is that what really happens is when they come in, the person's received, and the person's understood, and the person is believed, and the person is treated like a human being, and just like we want to be treated.
Right.
We give them that extra little TLC that's sometimes missing at other places.
Which is unfortunate, but it's probably true. I don't know. I don't know. I've never compared any other offices, so I can't really speak to it. I can just tell you what I'm told.
Well, one of the things that I'm not concerned about comparing is just, I know who you guys are, and I know how you treat people. And I'm just thrilled to be a part of a team of people who see others like children of God, if you will. I mean, that's the way I look at everybody, and I know they do. And we don't judge, we don't demean, we go out of our way to make sure you're comfortable and you're happy there. I mean, we have our own little coffee bar, bottles of water, whatever a person might need. Children need to come, okay, we accommodate that. And it's all about receiving you, listening to you, hearing you, and then saying, this is what we can do, or we can't do that. We're going to tell you straight up, one way or the other.
The other part too, Dr. T, is the fact that we explain to them what we see and what we find and the hows and the whys, which sometimes you don't always get in other places. And I think that's super important to most of our patients whenever they come in, because a lot of times they've never had anybody take that time and explain things to them and give them options and give them choices.
Mm-hmm.
That's well said, because one of the things we do, we have these big screen TVs, and we bring up the x-rays. We bring
really
up the
sit
diagnostic
and watch movies
studies.
all day.
What's that?
So we sit and watch movies all day.
You might, I don't.
You don't have Netflix.
No, but there's some. Go ahead.
Yeah, the reality is, though, you sit down with us. Okay, we've already discussed the case and what Nurse Linda's recommendations are going to be, but we want you to see why. We want to see you, see yourself, and say to yourself, that is not right. And what can we do about it? Because then the door's open to open the doors that you've closed in your life, saying, well, I can't do that anymore. Well, wait a second. We are all about trying to help you reopen those doors in life and saying, I can do that again.
And you don't sit there and think to yourself, I'm too old. I've had this hip problem for 20 years, because we've got 80-year-olds that have benefited from these injections.
Remember what I told you Saturday night? Linda and I went to the Nash Arts Center to the Motown Review Saturday night.
It was fun.
It was. And while some people were dancing in the aisles, the rest of us were dancing in our seats. But what we talked about was the fact that you want to rock and roll. The generation of the people that are in their 70s and their 80s, they come along through rock and roll music. And the vision came into my mind. How do you want to rock and roll in your golden years? Is it going to be in a rocking chair, in a wheelchair, or do you want to be up on a dance floor dancing to the band? So it's a choice you have, and it's real. You get an option to do it now.
So don't ever think it's too late, because you let us determine if it's too late. And we haven't found somebody yet that it was too late on.
What's really fascinating is that we sat there and looked at them going, okay, they have no other options. The surgeons have actually said, we can't work on you. Let's do our job and see what's going to work. I mean, literally, we compared x-rays yesterday or day before with one of our very first clients, 80-something years old, and literally the socket and the bone where the socket sits, the head of the femur, the called trochanter, it's sitting right up in here, right? And the acetabulum, it's the I got to bring a skeleton next time. It's where the femoral head goes in here. There were undetectable difference. You saw bone going to bone, and you didn't see a
It looked
line.
like just one big white blob instead of lines in between the bones.
And what did we see yesterday?
And you can see the delineation. You can see the lines forming, and it's much better. It's not where it needs to be, but it's only been, what, a couple months?
Yeah,
I
it's been
think.
3 months.
So, it takes 6 to 8 months for it to really work, and if he needs another shot, maybe, but probably not, because he's in much less pain.
Yeah, his hip's no longer the pain.
Right, now it's his knee.
Yeah. So what's happening, so when she says you can see a line, it's because the cartilage is regrowing and it's pushing itself away. It's making the gap that you see. You can't visualize cartilage on x-ray, but you all of a sudden you see this, and now you're starting to see a gap in there. That tells you there's tissue growing in between these two surfaces.
That's right. That's right. So, I've had it myself. I had an ultrasound in Denver.
Back in May.
And the girl that was teaching this class that I took said, "Oh my God." And it was so bad that she said to the class, she said, "All right, this is Linda's knee. Now I need, a regular knee." And so then she ultrasounded somebody else and showed the difference. But she put some regenerative medicine in my knee, and it felt a little bit better. I've known for, 10 years that I was going to have knee replacement. I was told that by a local orthopedic surgeon. And so I just I fought it as long as, well, I'm still fighting it. But anyway, so then we went back to Denver in November for another class, and she ultrasounded my knee again, and that time she put PRP in it, and we're going to talk to you about that in a minute. And but you could see the growth. It wasn't where I wanted it to be,
Not
and
yet.
it wasn't as pretty as that young person's knee that she compared me to, but it definitely was improved. So I'm grateful to be part of this, and I'm grateful to have the opportunity to experience it and to share it with you. So it is time for our first break, and when we come back, we're going to talk about PRP. I bet you don't even know what that is. It took me a month to figure out what the letters were, let me just tell you. I'm not the sharpest knife in the drawer, but I'd get there sooner or later. So hang on, and we'll be right back on.
But a culture where you're more than just a number? At UNC Health Nash, you can get both. Take advantage of great benefits, including signing bonuses up to $25,000, student loan forgiveness, and much more. Plus, gain valuable frontline experience in an organization that prioritizes nurses' feedback. Apply today at nashnursing.com and discover how you can get big city benefits at this small town hospital.
Are you looking for the perfect space for your business in Rocky Mount? Discover the individual offices available on the 4th floor of the Healthview Capitol building in downtown Rocky Mount. These offices provide a professional environment with stunning views, ample natural light, and modern amenities in a secure environment. Join a community of thriving businesses and elevate your company to new heights. Rent includes utilities and Wi-Fi, and for an additional fee, you can have access to the building's gym. Schedule a tour today by calling Leanne Wester at 252-977-1616, extension 1012.
Well, hello, welcome back. It's a new year, it's a new you, and it's a new logo for me tonight anyway. This is Linda Prezioso, here's to Your Good Health, and I've got with me Dr. Tim Treanor and Sherri Williams, and we're part of Horizon Medical, and we're talking to you tonight about integrative medicine. So even though Sherri is not medically trained, she's very smart, and she gleans from what she reads, and she retains it much better than I do, actually. So I'm going to have Sherri tell you about PRP.
Oh, thanks a lot. I thought you were going to give me a subject that I knew a whole lot better
Well,
than
I'm going to
PRP.
do that too. But I'll help you through this one.
Okay, all right, I'm going to keep you to
But
that
you
one.
tell them what you tell the patients what PRP is.
PRP is platelet-rich plasma that we take from the patients themselves.
It's protein-rich plasma, but we're not picking.
Okay, protein-rich plasma. See, they've been telling me the wrong thing all this time.
Maybe I'm wrong. Anyway, go ahead, baby.
So we take a vial of their own blood, and Linda spins it down in a centrifuge, and it separates things out so that she can then get the plasma and the platelets, and then she can turn around and use the ultrasound to inject them back into the joint. And it speeds healing with growth hormones, plus it also helps in cleaning out inflammation and any infections or bacteria that might be in the joint. And it just assists the regeneration injection, and or it cleans up the joint in advance of it to make a better place for it to go. Did I do all right, guys? You guys are the medical
She
ones.
said it beautifully.
That's lovely.
It's your own plasma, which she said, and it's full of antibacterial properties, antiviral properties, and we inject that into the joint first before we get to regen. We like to clean up the joint, so to speak. We want to make sure that that joint is as perfect as it can be when we put in this regenerative medicine. And so you want to tell them what's in the regenerative medicine? How do we get that?
Oh, the regenerative medicine. Would you believe it was over 100 years ago when they discovered this? Now, Dr. T can tell you all the details to that, right down to the doctor's name. I do remember it happened in Boston in a hospital, and it involved a burn victim that came in with severe burns, and they needed to do something to help keep it moist and to aid the healing. And they realized that in the birthing center, they just had a recent birth. They went into the birthing center and actually pulled the placenta and the umbilical cord out and took the inside part of it and laid it over the burn to help with the healing and to keep it moist. And what they discovered was that those cells inside the placenta and inside the umbilical cord helped build the new skin and took away the pain. And actually, it helped build the skin back better than the skin that had not been burned. So that's the birth of it. So this is a process that's really 100 years old, but it's not been promoted. So now we're promoting it, and instead of trying to lay this big patch over something, we're actually having it processed in an FDA-approved lab, and they send us these little vials, and in that vial is the good stuff. So what we do is we order that, and when it comes in frozen. It arrives overnight, and we take that, and you thaw it in your own hand, and once it's thawed and there's no ice crystals in it, then Miss Linda over here takes and puts it in a syringe. We use the ultrasound again to put it right into the joint exactly where you need it so that we can make sure it's in the right place. We don't want to get close to it or in the same area. We want to put it exactly where it needs to go because that's important. And that's the stuff that promotes the growth of the cartilage. When you're young, you have a lot of things in your body that helps promote you to grow and to build cells in your body. As you age, you don't have as much of that. So what happens, guys?
Nobody on this panel is aged. Everybody here is still in their 20s.
We're all very young, yes.
But so this helps stimulate your body. It gives you that little extra kick, and it tells your body, okay, we need some more of this stuff that helps us build this cartilage back. So it calls in all the resources in your body. You may have to make some extra stuff, but it stimulates your body to do what it needs to do to rebuild the cartilage. So it rebuilds your joint. And it's your joint, not a mechanical joint.
We put in what we call signaling cells. And you put those signaling cells in the joint, and then it says, here I am, come and feed me, because we have stem cells in our bodies. They're all over. That's how God made us. But when you put those signaling cells in, then you get an extra whoosh into the joint where the stem cell signalers are placed.
Well, it's well said. It's the whole idea is it's turning your body on to do something that it doesn't have enough of at the moment to do. In other words, we're resupplying, we're coming in with new supply of the materials that is required to rebuild and to create the moment of rebuilding. And so when the injection happens, and it's 98% accuracy when we're using ultrasound guided, and that's why we spent the money to get the nice, beautiful ultrasound machine that Nurse Linda can see all the tissue, and we can actually see tissue healing and growing. We can also see torn tissue. Soft tissue does not show up on x-ray. So
right.
We can actually use it as a diagnostic procedure as well to find torn meniscus, torn ligaments, torn tendons, torn muscular tissue, something that we can't see on x-ray. But now we have the ability to identify and say, hey, here's the problem. And what's fascinating to note is one of our clients came in and he had been told, you've got a torn meniscus. Well, we go in and we see the torn meniscus, and then we go, wait a second, how did your injury happen again? And well, I hit something with my foot when I was riding my motorcycle, and it twisted my foot out. And then I went, does it hurt here? And I pushed on the side of his knee. Yeah. Does it hurt over here? Yeah. Does it hurt over there? Yeah. Holy cats. Not just the meniscus was torn. We discovered that his lateral collateral ligament was torn, that his medial collateral was torn, the vastus medialis tendon was torn. I mean, we discovered all of this in the process of helping this individual with just a torn meniscus. And so that's the power of what we're doing. And that's the power of trained nurse here with these materials and such, and trained eyes on the scene, so we can really figure out what's going on for you. And this HCTP, human cellular tissue product that you get from the lab, and where our lab gets them from, by the way, is from cesarean section. And why is that important? Well, it's important because baby's born and happy, mom's alive and happy, and the cesarean is received without destruction. And so they're able to process the parts that have no DNA from mom, no DNA from baby, and so when they go into you, they become you. And there's no reactions, there's no anything other than this is now going to help you.
So give us a little bit of background in Boston 100 years ago.
Maximilian Stern, MD. It was an emergency room, 1923. Emergency, that's 100 years ago, 101 years ago now. Emergency room, MD. Person comes in from a horrible fire, horribly burned. And like you said, we know that stem cell helps. We know this things help, and we know that's in the placenta. Do we have any placentas available? And so they went to the birthing center, and yes. And like Miss Sherri explained, they actually opened it up, laid it across the wound, and wrapped it. Within 2-3 days, they're like, wow, this wound is really healing, and the patient was reporting no pain. Within 2 weeks, it was extremely healed and almost gone. Within 2 months, they could not tell. They said that skin is now better than the skin around it. Recently, one of my friends had skin cancer removed on his face. One was the size of a quarter and another size of a dime. And he had this regenerative material, this HCTP, injected into the sites. Within 2 weeks, you couldn't see the.
Are we going to do that next?
No, we're not going to do that.
Okay. Just check.
We're going to focus on joints. So because one of the most, if you do the research, you find out the knee joint is the most complained about joint. But we can actually do the low back. We can actually do the hips, the elbows. As a matter of fact, you're getting really good. And the shoulders.
Yeah,
And we have several shoulder people that are
hips, knees, and toes.
head, nose, knees, and toes, yes. But with all kidding aside, this is not a joke. This is reality. This is the latest technology. And we have it right here. And why, again, back to the why with medical, why chiropractic and rehab? Remember, these are signaling cells. Chiropractic is the signaling system. The nervous system is the signaling system. And so when we liberate that system through the chiropractic adjustment of the spine and of the joints themselves, when we liberate that system, the signals are clearer and more concise, and the tissue knows where to go and how much to be made. It's really fascinating. I got to be honest, I'm blown away by the reactions that people have had and how they have changed. I remember my own reaction, and I thought that was pretty cool, but because I had it too. I had it back in May, and it didn't take long for me, and people are going, how's your knee still? I mean, my knee is still fantastic. It is still fantastic. I was kneeling on it just the other day to look under my motorcycle for something, and there's no knee pain. And I love it. I really do. You know, what do they call it? Crisscross applesauce? How you sit with your knees crossed? I can do that again. Yeah, I know. You're like, no way. Yeah, I can sit on the floor and play with grandkids. You know, it's just, I love it.
And you know they're doing a lot of research into hearts with regen, and I get these blogs from Karen Rea who taught me how to do the injections, and they're looking into it in other body parts. So in the next 20 years, it's not going to be cutting edge anymore. It's going to be standard.
Yep.
It's just getting from point A to point B.
Yep. Oh, and you brought up the point, though, about how to pay for it. And why doesn't insurance pay for it? Okay, because the politics of it, The insurance is and big pharma are not going to pay for this. They really don't like the idea
Because
that
they're not involved.
yeah, they're really not involved with it.
It means you don't need the pain meds anymore.
Yeah.
Yeah, and you don't need the artificial joints, and so the surgeons aren't happy because that's their income. And then the guy that sells you the products, he's not happy because it erodes into his income. So I mean, I get it. I understand it. But anybody who's watched this show for any length of time, and anybody who knows me knows that I don't really care about all that. I care about the patient and what's best for the patient, and that's what I focus on. I can't be focused on, this guy and this guy. Sorry, I'm just focusing on you. And so that's, I think that's what we do in that office too, for the most part.
But guys, we often run into people that are not the best candidates for any kind of surgery, much less a replacement surgery.
That's true.
Because it's so involved and there's so much risk there with them due to other health issues they may have.
And age.
So, plus their age, but it also gives them an opportunity to gain back part of what they've lost. And having worked in senior living since 2012, you see the difference that it makes, because a lot of people move into assisted living and or a semi-independent living situation because they can't do the things they need to do to take care of themselves at home. Whether they've had a stroke or not a stroke, some of it's just deterioration of their hip joints or their knee joints, or they have an issue with their back, but they simply can't do it, so they have to move somewhere. And the amount that you pay for 1 month of assisted living can pay for regen. So you spend it once and fix your joint and have no more pain and get to rock and roll in your golden years like you want to, or you can spend that every month paying for assisted living or semi-independent living until you don't need anything anymore.
It's very true. That's why I brought her along. She's got all of that part of it.
Well, see, that's Sherri's job. She's the advocate.
Right.
Okay, she listens to you, and the intake, she listens to what's going on. You explaining, and she wants to know it all. And so she hears you, and then she explains it to Linda, okay, nurse practitioner, who does a very thorough functional evaluation of you. Okay, and then she makes recommendations. What kind of diagnostic testing do we need to do? Do we need to do x-rays? Do we need to do ultrasound, or both? What do we need to do? And then we, as a team, we sit down together and we talk about you again. But not like your friends do. We talk like somebody who wants to help you. Okay, I shouldn't have said that, but you know how people are. We talk about what's going to help you. And then what happens? You come in, you sit down with us again. We have the presentation of here's what's going on, here's what can be done about it, here's what should be done about it, and here's the opportunity for you to receive what you need to receive. And once you've come to that point where you go, that's what I want, you sit down with Miss Sherri and you create a calendar. She's your advocate. She's the person on your side of the table going, here's how we're going to help you receive what you're looking for here. And there's really no reason not to receive it. I mean, people talk about time and talk about money, but like Sherri just pointed out, and Miss Linda's made the point as well. I mean, I asked the ladies one time, I said, this much money is a lot of money. And well, yeah, that's a lot of money. I said, but is it a lot of money for a transmission? Is it a lot of money for assisted living? Is it a lot of money for the rest of your life on pills and co-pays of surgeries that fail? I mean, seriously, we got to think about these things, So
Yeah, because those surgeries do not guarantee all the time that your pain is going to go away.
No.
And sometimes it doesn't, or sometimes it takes an extremely long time, and sometimes you don't get your full mobility back. Everybody is different. Sometimes they get the replacements and it works wonders, but not always.
That's right.
do you know what a successful surgery is? They put it in right, the way they were supposed to. Not the outcome, but they put it in the way it was supposed to be put in.
All right, it's time for our next break.
Oh, man.
And I
That
know.
flew by.
I know. And when we come back, I don't know what we're going to talk about, but we'll figure out something. So don't go away, and we'll be right back after word from these sponsors. Hang on.
but a culture where you're more than just a number? At UNC Health Nash, you can get both. Take advantage of great benefits, including signing bonuses up to $25,000, student loan forgiveness, and much more. Plus, gain valuable frontline experience in an organization that prioritizes nurses' feedback. Apply today at nashnursing.com and discover how you can get big city benefits at this small town hospital.
Are you looking for the perfect space for your business in Rocky Mount? Discover the individual offices available on the 4th floor of the HealthView Capitol building in downtown Rocky Mount. These offices provide a professional environment with stunning views, ample natural light, and modern amenities in a secure environment. Join a community of thriving businesses and elevate your company to new heights. Rent includes utilities and Wi-Fi, and for an additional fee, you can have access to the building's gym. Schedule a tour today by calling Leanne Wester at 252-977-1616, extension 1012.
All right, we're back. We're going to talk about side effects of this treatment. Tim, what are the side effects?
Well, it's fascinating. You should know. Believe it or not, there are no side effects to regenerative medicine. Okay, the regenerative medicine creates, and the PRP, by the way, platelet-rich, protein-rich, whatever you want to call it, plasma. The side effects are, I did, that was very political, wasn't it? But the side effects are that your body's going to have a reaction to it in such a way that it's trying to heal. And so my personal reaction when I had it is that my knee swelled up. It swelled up for about 12 hours, and that was about it, and it wasn't bad. Some have a deeper reaction. It depends on certain things, because believe it or not, one of the things we have to make sure is that you're ready for this. And so we look at what you're eating and what you're taking in. We want you to reduce your sugar content. We want you to reduce your salt. No ibuprofen and things like this. I mean, there's things we want you to do to be prepared. And that's what the PRP is about too, is that preparation for the regen when it comes in. But the side effects, mine were, my knee pain went away. My foot quit dragging. I can play tennis again. I can ride my bicycle again. I can swing my leg over the motorcycle. Those are side effects. I can sit cross-legged. You know, what do you call it?
Cross-legged is
Cross-legged, crisscross applesauce. Yeah, we
not
can't.
sure
And
about
so,
that one, but okay.
but those are the side effects. I got my doors that had been closed of life are now open. I actually ran a mile. I ran a mile. It was on a treadmill, but I ran it, going 4.5 miles an hour, but I ran it. I know you're like, you've got to be kidding me. No, I'm not kidding. I can get on a treadmill now and walk for 20, 30 minutes, no big deal, or I can walk around my neighborhood, but it's been a little too wet and too cold for that. But I can walk without pain in my knee. That's powerful to me. I can sit there on a date in a restaurant, my knee's bent underneath the table, and it doesn't start aching and pain. I can fly in an airplane for hours, which we seem to do a lot, without knee pain. I'm serious.
It's a long way to Denver, y'all.
Yeah.
Especially when you fly some flights that I think they purposely make them uncomfortable. I'm not quite sure, but anyway, I was going to say something.
What's your favorite side effect so far?
No pain.
Oh, I don't know. Salvador.
I know what I was going to say. Salvador. Now he's a great story.
He is a great story.
Tim ran into him someplace. I don't know,
Lowe's.
Lowe's or someplace.
Pitching Lowe's now.
And said, "Well, you ought to come to my office." So he came in on a Friday when these guys don't work. I'm there for my Medi-Spa. And he walked in and you know, he said, "I saw Dr. Tim and he told me to come to this office." And so I explained that, you know, it wouldn't be over the weekend, but he could come in on Monday. And I think he was about there when the doors opened on Monday. And he had bad pain in his I don't remember which
Left knee.
knee.
Left knee.
In his left knee, and he was hobbling, and he could hardly walk, and he was miserable, and he was looking for help. And so we did regen in his knee, and I don't know, it was still during his rehab process, which the whole process with all the rehab and everything takes, what, about 12 weeks?
Mm-hmm.
And so it was within that 12 weeks, and he was talking to Tim, and he said, "Miss Linda, come and sit right here. And he started crying, and he said, "You have saved my life." He said, "I spent 80% of my time sitting in a chair because my knee hurt so bad. Now I don't spend hardly any time in my chair. I can get up, I can work, I can do what I need to do." And he was just so grateful.
And the cherry on top of that was that he comes strolling in one day and kind of sambaed his way in and danced his way in through the front door to show everybody what he could do that he hadn't been able to do in years.
He was showing you his moves.
Showing us his moves.
And we've also had patients that have had a knee replacement on one side or the other, and they didn't want to they needed another knee replacement, and they didn't want to do it for various reasons. And so they've chosen to do regenerative medicine, and all of those, it's 2 or 3, I can't remember for sure.
There is, and there may be more than that. But one of the big things, he's talking about side effects, one of the big side effects is there's no downtime. They don't have to quit living their life. The doors may not be open back up to do all the things they used to do, but they can still do their daily routines. We do ask them to restrict some of the heavier things like jogging and running and riding a bike or using an elliptical, because of the pressure it puts on hips and knees, and some weightlifting. But at the same point in time, they're not stuck in a bed, they're not looking for a wound to heal. All that's gone. Mm-hmm. It's not existent whenever you do the regenerative injection.
And the rehab after a regen is not painful. Physical therapy after a knee surgery is painful. Some people don't ever do it because it's so painful, and then they really don't have a good outcome, because you've got to have that portion of it. Just like you do in regen, you've got to have your rehab, and that's part of what we do at the office. So that's why it takes about 12 weeks from start to finish, from deciding to do it, me injecting, and Tim working with you with the rehab portion, so that you come out with the best outcome. And if you don't do those 12 weeks, we've had those people too, and they're the ones that come back whining and crying, "It still hurts, it's not working." Well, you've got to do your part, and you know how much my audience knows. I tell you all the time, you have got to do your part. You can't, whether it's eating well, you've got to cook, you've got to buy the food, you've got to prepare it. You can't go out and eat every day. Even if you eat healthy choices, you've got to be focused on what you're doing with this food. You've got to be focused on moving. It's just, we are made to move. God made us to move. There's one reason that way back in the day, farmers could be in those fields 16 hours a day, because they were made to move. And all we do is sit like this most of the time. And I'm guilty, I'll tell you that.
Well, years ago, I can remember growing up with grandparents and great-grandparents, and the old adage was, if you don't use it, you lose it. Mm-hmm. And that's true. If you don't use your body, if you don't use your joints, then you lose that capability. And that's just not fair. It's not the way you should want to live your life.
That's right.
One of the things a lot of people feel like they won't get up or whatever because it hurts to move. Mm-hmm. You've got to make them first move. You have to come in. One of the things they actually do to test for osteoarthritis and how osteoarthritis affects the joints, what they used to do, and it sounds cruel, they would get a small animal and actually brace their joints so they could not move it. And then they'd draw, or what they call serological draws, taking the fluids out of the joint just to test it. How's it doing? And what's it going through? They'd x-ray it, they'd MRI it, and they see that it break down. With the lack of movement, the joint would break down. Anybody have a broken arm where you had to have your arm in your cast?
I have not, praise the Lord.
Same arm twice.
And so when you get out of that cast, what's the first thing? You're like, oh my goodness.
Yes.
Now you can get it back, and because that's the other thing they test with osteoarthritis, can we get the movement back? Yes, they can get the little animal to get its movement back. But as the reality is, guys, if you're not moving, well, you're falling apart. It's called entropy. The whole idea is that you actually degenerate by just sitting there, okay? And so we want to get you back on your feet. We want to get you moving again. We want to get you so that you don't have to go run a marathon. But doggone it, walking around the street with your puppy is just a wonderful thing. Dancing with your sweetheart in the kitchen, oh my gosh, without pain, okay?
Or going to the grocery store like Miss Jean.
Like Miss
Or
Jean.
Dollar General.
Or Dollar General, that's right.
Oh, so and what was really cool about Salvador, when I met him, I mean, he was practically in a crutch, and he was right there at Lowe's in the paint department, and I was talking to a friend of his who was a friend of mine, and he walks up, and I go, dude, you need me. And he goes, what are you talking about? And I said, you need what I do. You need what I do. It's going to change your life. And he's like, I'm ready for my life to change. Okay? Now I can take it in Spanish. Mira, hombre, necesito un cambio acá porque su rodilla está. And he said, oh, sí, me quiero un cambio. I want to change. And he took it seriously, and he's worked for him. And I wish I had videoed him dancing into the office. Oh, one more. You can actually go to our website, horizonmedical.us, and look at the latest newsletter. There's a couple of testimonials, and one is Brenda Clark. Oh my gosh, what a sweetheart. But she came in. Guess what I did this weekend? I'm like, I have no clue, okay? And she goes, I went to a wedding. I said, well, fun. She goes, no, you don't understand. I went to a wedding 8 years ago, and I danced one dance, and I couldn't move for 3 days. I said, so did you dance? She goes, I danced every dance, even the line dances. And I go, and how are you feeling? And she goes, I feel fantastic. I mean,
true.
The joy in this person's face. So yeah, go to horizonmedical.us, horizonmedical.us, and you can see our newsletter. Sign up for it, and because you can see the research, because we have it on there. We have the people that are going through this, and it's a lot of fun. It really is a lot of fun.
It's a lot of work, too.
It is work. It's work, and doggone it's work. It's worth it.
Satisfying work.
Well, you see where you're going. You see your accomplishment. You see you getting yourself back to where you used to be. So you talked about side effects. Side effects is you get your life back. Side
Right.
effects is you get to move.
Right.
Side
right.
effects is you get your joy back. And that's important.
And, they do a lot. Now, they do some PRP, and PRP is along with Regen, but we've got a couple of teenage boys that have got some issues with their knees and their shoulders. And so you don't want to do Regen on somebody that young, because they've still got everything they need. For the most part, I guess there's always an exception to the rule. But, and that is really good for young athletes and things like that. And I know that some of the sports teams, they will send their players like down to Mexico and places like that to get Regen or to get PRP. So it helps everybody. Most young people don't need it, but you're going to have the kid that plays soccer and kicked the ball the wrong way and went down and tore a meniscus or something, and then we can help with all that too. So it's not just for us oldies but goodies.
No, because some of the bigger universities are actually reaching out to some of our members that with AMI, and they're sending their sports injuries to that clinic to get the PRP and to get the chiropractic treatments and the therapies to go along with it. That's part of their protocol now to put their athletes back on the field healthy.
Right. And it's all natural. It's all you. I draw your blood out of you, I spin it down, and I put it back in. So there's nothing foreign, so there's no rejection, there's no problem with any of that, because it's you. So
the answer is yes. You can use it, and it'll help you. Well, from our experience, we can't sit there and guarantee anything, but we can say it has helped this person, this person, this person, and you're a lot like them. We cannot definitively just say guaranteed. We just can't do that, not for any situation. However, we can say in our experience, we have seen this help so many people, and we look to help more. That reminds me of one more thing. Should you not be the person that needs it, please, please find that person who does. Should you not be the person stuck on opioids right now, please help them get a hold of us. Help us connect with them. And Linda, one more thing. We're looking to hire an amazing front desk administrator type person. Yeah. And we're looking to hire. So I'd like your resume sent to horizonmedical.us. No, excuse me. I'd like them to send to hello@horizonmedical.us. You know somebody that would be a wonderful addition. You see how effervescent these two ladies are. I mean, seriously, they're so bubbly. It's not just the hair.
We got a lot of hair. Sherri and I got a lot of hair.
We do.
But the reality is we're looking for that other teammate right now to build upon what we're doing. And we're not looking for a McDonald's job here. We're looking for somebody who wants to create a career, okay, that wants to grow with us, because we are going to grow, because this is so needed in this community and in this region. So I thought I'd just pitch that for a moment.
Awesome. All right, we got a minute left, so give me a recap, Tim.
Start with me. Regenerative medicine works. PRP works. There's not an age limit. Let us have a minute to sit down with you as a team and determine whether or not this really can help. I kid you not, guys, and I get emotional when I talk about this. It works. It is saving lives, even as we're talking right now. That just the people we've helped, their lives have changed.
So you can give us a call, 252-210-3490. Recap, Sherri.
You try a lot of other things. You see a lot of other people. You listen to what they have to say. Why not try something else? Something that's new, that's cutting edge, and that doesn't have the downtime and doesn't have the drawbacks to the ultimate last resort of surgery. Why not? Why not come in and see what we have to offer?
We're not going to twist your arm. We're not going to say, all right, you're going to do this, and it's going to be done on Tuesday, and Linda's going to inject. No, we just present the picture. And then you know, as Tim said earlier, he gives his portion, I give my portion. And you can look at your x-rays and you can see there's very few people that when we sit down and show those x-rays and explain that walk away and say, well, this is a bunch of hooey booey. I don't know that's ever happened, but you know, and so just come and talk to us. That's all you got to do. We're gonna just welcome you with open arms, and you'll get a hug from me. So there you go.
The best hugger in the county.
That's right.
Here's the thing. One more just quick thing. We are now seeing these people graduate from our program, our protocol, which is the best protocol there is. And guess what we're seeing? We're seeing regrowth in their joints as we take the x-rays.
Oh yeah, after 3 months. Yep.
It's so fun.
All right, it's time to say goodnight. Thanks so much for watching, and I'll see you next week. I don't know if I'll be a new year, a new you, or if I'll be Here's to Your Good Health, or a combination thereof, but I will see you next week. Y'all have a blessed week. Good night.